One of the most common symptoms of pleural mesothelioma is shortness of breath. And in many cases, that breathlessness is caused by pleural effusion, which is fluid buildup in the space around the lungs. If you've been told you have pleural effusion, or if you're experiencing progressive difficulty breathing and you have a history of asbestos exposure, you need to understand what pleural effusions are, why they happen in mesothelioma, how they're treated, and what they mean for your prognosis. Today, I want to explain everything I can about pleural effusions in mesothelioma. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But I hope that sharing what I know about pleural effusions will help you recognize symptoms and understand your treatment options. To understand what pleural effusion actually is, let's start with where it happens. The pleura is a thin, double-layered membrane that surrounds your lungs. It has two layers: the visceral pleura, which covers the lung surface, and the parietal pleura, which lines the inside of your chest wall. Between these two layers is the pleural space. It's normally a very thin gap containing just a tiny amount of lubricating fluid, maybe a tablespoon or two. That little bit of fluid allows the lung to move smoothly against the chest wall when you breathe. Pleural effusion occurs when excess fluid accumulates in this space. Instead of just a tablespoon of fluid, you might have a cup, a pint, a quart, or even more. The fluid takes up space in the chest cavity that should be occupied by your inflated lung. It compresses the lung and prevents it from expanding fully. Now, before I go on to talk about what pleural effusion has to do with mesothelioma, I'm going to take a break and ask you a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. So, why do pleural effusions develop in mesothelioma? While normally there's a small, stable amount of fluid in the pleura that's constantly being produced and absorbed at equal rates, mesothelioma tumors disrupt the normal fluid balance in a few different ways. Tumors can block the lymphatic channels that normally drain fluid from the pleural space. And if fluid can't drain properly, it accumulates. Tumor growth can cause inflammation, and inflamed tissues produce more fluid. The tumors themselves can produce fluid, and blood vessels can become leaky in the presence of cancer, and that allows more fluid to escape into the pleural space. The result of any and all of these is that fluid production increases while drainage decreases, and that causes significant fluid accumulation. What are the symptoms of pleural effusion? The primary symptom is shortness of breath that gets progressively worse. Early on, breathlessness may only occur with significant exertion, like climbing stairs. But as more fluid accumulates, you become short of breath even with a minimal activity like walking across a room. Eventually, you might be breathless even when you're at rest. And this breathlessness often gets worse when you're lying flat, because gravity allows the fluid to spread across more of the lung surface. Many patients find they need to sleep propped up on pillows or in a recliner to be able to breathe. Other symptoms, they can include a dry cough from irritation of the compressed lung, chest tightness or heaviness from the pressure of the fluid, and fatigue, which happens because your body isn't getting enough oxygen when your lung can't expand fully. How is pleural effusion diagnosed? A chest X-ray will show fluid as a white area at the bottom of the lung where fluid pools due to gravity. Moderate to large effusions are easily visible on X-ray, and a CT scan provides even more detail. It can show even small effusions that an X-ray might miss. CT also has the advantage of showing underlying pleural abnormalities like thickening, nodules, or masses that indicate mesothelioma. That's why screening using a CT is always preferable to X-ray. It's going to pick up a lot more and it could save you valuable time. Ultrasound can also be used. It can detect fluid, and it's often used to guide procedures to drain the fluid out of the pleural space. Now, how is pleural effusion treated in mesothelioma? The first treatment is usually thoracentesis. It's a procedure where a needle is inserted through the chest wall into the pleural space to drain the fluid out. This can be done with local anesthesia in a clinic or at the bedside. A catheter attached to the needle allows the fluid to be drained. And for many patients, the process removes a liter or more of fluid. It provides immediate relief, and most patients feel dramatically better. They can breathe more easily and they have more energy. Unfortunately, in mesothelioma, the fluid almost always comes back because the underlying tumor is still there and is still disrupting fluid balance. The fluid can reaccumulate over days or weeks. For recurring effusions, there are several treatment options. An indwelling pleural catheter is a small, flexible tube that's inserted through the chest wall with one end in the pleural space and the other end outside of the body. The external end has a valve and it can be connected to drainage bottles. Patients or family members can be taught how to drain the fluid at home as needed, and that's typically every 1 to 3 days. It may sound like a lot, but it allows ongoing fluid management without having to go through repeated thoracentesis procedures. The catheter can stay in place for months. For some patients, the pleural space will eventually scar closed around that catheter, which is great. It stops the production of fluid, and the catheter can then just be removed. Pleurodesis is another procedure for treating pleural effusion, and it involves talc or some other chemical agent being moved into the pleural space to cause inflammation that makes the two pleural layers stick together. When the layers are stuck together, there is no space for the fluid to accumulate, so effusion stops. Pleurodesis can be performed through a chest tube or during thoracoscopy. The success rate is variable. When it works, it prevents or greatly reduces fluid reaccumulation. But it doesn't work for everyone, especially if the tumor burden is heavy or if the lung can't fully re-expand after drainage. Treating the underlying mesothelioma with chemotherapy, immunotherapy, or other systemic treatments can sometimes reduce effusions by shrinking the tumors that are causing the problem and reducing inflammation. But effusions often persist despite treatment. Surgery, such as pleurectomy, decortication, removes the pleura, and that eliminates the source of fluid production. But surgery is only appropriate for selected patients diagnosed in the early stage of the disease and in good overall health. What happens if pleural effusion is left untreated? Chronic breathlessness significantly impairs quality of life. Severe effusion can lead to respiratory failure, where oxygen levels drop dangerously low. An infection can develop in the pleural fluid, which requires urgent treatment. And long-standing effusion can cause the lung to become trapped and unable to re-expand, even if fluid's drained. That's why managing effusions is an important part of mesothelioma care, even when the underlying cancer isn't curable. Can you prevent pleural effusions in mesothelioma? Not really. They're a direct consequence of the tumor. However, early treatment of the mesothelioma itself can prevent or minimize effusions, and prompt drainage when effusions develop can prevent complications and maintain quality of life. What does pleural effusion mean for your prognosis? The presence of pleural effusion indicates that mesothelioma is active and that it's affecting pleural function. However, effusion alone doesn't necessarily mean advanced disease. Even relatively early stage mesothelioma can cause effusions. The amount of fluid and how quickly it reaccumulates after drainage can provide some prognostic information. Massive effusions that reaccumulate very rapidly may indicate more aggressive disease, but this isn't absolute. Prognosis depends much more on factors like cell type, stage, and treatment response. Managing pleural effusions is about maintaining quality of life. Even when mesothelioma can't be cured, controlling fluid accumulation allows patients to breathe comfortably, remain active, and maintain better overall function. This is an important goal of palliative care. So, what should you ask your doctor if you're experiencing pleural effusion? What's causing the fluid to accumulate? How much is there? Do you recommend drainage? How often is the fluid likely to come back? Should we consider an indwelling catheter or pleurodesis? What treatment of the mesothelioma will help reduce the fluid? And what should I watch for? Don't suffer in silence if you're short of breath. Pleural effusions can be managed, and drainage often provides dramatic relief. So to review, pleural effusions are excess fluid accumulation in the space around the lungs. They occur in most pleural mesothelioma cases. They cause progressive shortness of breath by compressing the lung. Effusions develop because tumors disrupt normal fluid balance. Treatment includes thoracentesis for drainage, indwelling catheters for recurrent effusions, pleurodesis to prevent reaccumulation, and treating the underlying mesothelioma. Managing pleural effusion is critical for maintaining quality of life. You can visit mesothelioma.net for information about pleural effusions and symptom management, or call 1-800-692-8608 or use the live chat feature on the website to work directly with one of our helpful patient advocates. As for me, remember to post questions below, and I'll see you next time.